Hello everyone, hope you're all doing good. In this video, we are going to discuss about the intrauterine contraceptive devices. Now, I'm mentioning it as IUCD because I don't want a confusion between intrauterine death and intrauterine contraceptive device. Okay, so what are these devices? These devices are it is made up of plastic or metal, whatever it is, but it is inserted into the uterine cavity to prevent pregnancy. Okay, so the first point is that it is made up of plastic or metal, and then it is inserted into the uterine cavity. That's why it is called intrauterine device, and this can be hormonal or non-hormonal as well. Okay, so what are the types of intrauterine devices we have? Okay, so types of intrauterine devices include your Lippes loop, which is an inert intrauterine contraceptive device, and then we have copper containing IUCD. It can be copper 7 or copper T200 or copper 388. You also have multi-load copper devices, which is copper multi-load 270 or 375. Okay, and you have hormone releasing intrauterine contraceptive devices also. So hormone releasing intrauterine contraceptive devices will include your progesterone intrauterine device, and then levonorgestrel intrauterine device, which is your Mirena. Now, some of the newer found levonorgestrel devices are also there, which will include your Skyla and Lilita. Okay, so these are the various intrauterine devices we have discussed so far. This is Lippes loop. We are not using it anymore. This is copper T200 and this is copper T388. Okay, so the difference is that in the horizontal arm, on copper T388 has copper coils. Okay, whereas in copper T200 it doesn't have anything. Okay, so regarding copper 388, it is a T-shaped device. Okay, so you have a vertical arm as well as a horizontal arm. You have vertical and horizontal arms, and the arm contains 380 millimeter square of copper in both the arms. That means in the vertical as well as in the horizontal arms. Okay, it is made up of polyurethane and impregnated with barium sulfate. The end base consists of a ball. If you see here, yes, it consists of a ball which is 3 millimeter in size. Okay, ball which is 3 millimeter in size. So this will be preventing the IUCD from falling down through the cervical opening. Okay, so prevents from falling down through the cervical os. Clear? Right. Now this one is a multi-load copper device. So this is multi-load 375. If you see, you have a U-shaped flexible ring here. Okay, so you have a U-shaped flexible ring that is serrated. Okay, 3, 4, 5. 5 stubs on each side. Okay, you have 5 stubs on each side. It is a serrated one. Okay, and then why these serrations are there means it will help in placing the device in the uterine cavity itself. Okay, then the length of this device will be around 36 millimeter, which can be used for 5 years. Okay, and you have to know that copper here is present only in the vertical limb. Okay, so copper present in the vertical limb only. Okay, that's all. Now, let us discuss about the mechanism of action of the copper containing IUCDs. So, copper containing IUCDs mainly prevents fertilization. Okay, prevents fertilization. How means there is a local inflammatory action that is created by these copper containing devices. Okay, there is a local inflammation reaction. So this is the most important mechanism by which these copper containing IUCDs act. And then it can be gametotoxic to both egg as well as sperm, and then it is toxic to the blastocyst as well. Clear? Right. Now, we have some contraindications of using this intrauterine contraceptive devices also. So, what are those? In pregnancy, you shouldn't use. During puerperal sepsis, or there is an unexplained bleeding PV, you shouldn't use this. And finally, when there is carcinoma cervix or endometrium, whatever it is, you shouldn't use. And then there is fibroids because there can be distortion of the uterine cavity. Okay, so that time also you can't use. And then pelvic inflammatory disease or pelvic tuberculosis. Okay, so these are the conditions where insertion of copper containing IUCDs or IUCDs is contraindicated. Clear? Right. Now, what is the timing of insertion? So, when you can insert these IUCDs? So, at two stages, either you will insert it in a normal woman who is expecting a contraception. So, in those women, you have to insert it within 10 days of cycle. Okay, and suppose if the woman has delivered a baby, then right from puerperium, you can insert the IUCDs at 3 different stages. Okay, so first stage is a post placental stage where the IUCD can be inserted within 10 minutes after delivery. Okay, and the next one is a postpartum period where the IUCD inserted anytime after the 10 minutes. Okay, till 48 hours of delivery. And then it is interval insertion where it will be inserted up to 6 weeks after delivery. Clear? So, these are the various timing of insertion of IUCDs. Now, let us discuss about the levonorgestrel containing IUCDs. So, levonorgestrel IUCDs include your Mirena. Okay, so this is the most important one and the most commonly used levonorgestrel IUCD. So, this contains progesterone, which is levonorgestrel 52 milligram, and this releases 20 microgram of progesterone per day, and this can be used for a period of 5 years. Okay, and the newer generation levonorgestrel IUCDs include your Lilita, which is similar to Mirena. The only advantage of this is the cost is less. Clear? And the next one is Skyla. See, Skyla is comparatively having a smaller frame when compared to Mirena IUCD. Then it has 13 milligram of levonorgestrel and it releases 6 microgram per day, and Skyla can be used for a period of 3 years. Clear? Right. Now, if you see, this is the picture of the levonorgestrel containing IUCDs. This is Mirena. You will be having it like this. This is Skyla IUCD. The only difference between Mirena and Skyla is that Skyla is somewhat smaller frame. Okay. So this is you will be having a flexible arm, soft threads, and hormone reservoir as well. Okay. So this is the hormone reservoir part. Okay. And you also have a flexible thread. Okay. And this is how the Mirena IUCD will be in place after insertion inside the cavity of the uterus. Okay. Now, let's see what is the mechanism of action. Mechanism of action of levonorgestrel IUCD is that it prevents implantation. Okay, it prevents implantation. You also have some of the non-contraceptive uses. So, non-contraceptive uses of using Mirena, okay, include, you can use it in abnormal uterine bleeding, then endometriosis, adenomyosis. You can even use it in endometrial hyperplasia. Okay. See, one point I have to substantiate here, we have seen about emergency contraceptives where we have discussed copper containing devices, that is copper T IUCDs can be used as an emergency contraceptive. We are not going to use this Mirena or the other levonorgestrel containing IUCDs as an emergency contraceptive because there is a slightly higher risk of ectopic pregnancies in these devices. Okay, so that point should be clear, right? Okay. Now, what are the advantages of using IUCDs as completely, okay, including your copper T, levonorgestrel IUCDs, whatever. So, advantages of IUCDs. IUCDs are immediately effective and it is the longest method of contraception. Then it can be easily removed as well at any time. It requires no daily attention. And finally, it is convenient to use. Okay, there is no intervention to be needed before, during or after your coital activity. Okay. We also have some disadvantages. Very important point, it doesn't prevent against STDs. Then, always it requires a healthcare provider for both insertion as well as removal. Yes. Then there is a risk of pregnancy or fertility as well. And then sometimes the women may complain that insertion as a painful procedure. And finally, there is increased cramps and increased bleeding during her regular cycles as well. Okay, so these are some of the advantages and disadvantages. Let's discuss about the complications of IUCD now. So, complications of IUCD, as we have discussed, there can be cramping pain, or even vasovagal attack also possible immediately after insertion. There can be heavy menstrual bleeding. I told you, the bleeding can be excessive. So, the time menorrhagia can occur that can result in anemia. Some women even complaints of dysmenorrhea. There are chances of expulsion, perforation. Okay, I'll explain you about this perforation now. Other things may include there can be infection and chances of failure is also there. Okay, the chance of failure for copper containing IUCD with perfect use is 0.6 per 100 women years, and this is perfect use. Okay, and if there is typical use, then it is around 0.8 per 100 women years, and for levonorgestrel IUCDs for both perfect and typical use, it is around 0.2 per 100 women years. Clear? Right. And also there is a chance of pelvic inflammatory disease as well as ectopic pregnancy. Clear? Right. Now, let's discuss about perforation of IUCD. So, perforation as such is very rare. Okay, so it is only 0.1 percentage, and this risk is more when the woman is within within 6 months after her delivery. Okay, so within 6 months after childbirth, and this can be expected at the time of insertion itself, or sometimes it can even occur spontaneously after that. Okay, it can be a partial perforation or a complete perforation, or sometimes the device would have been migrated. Migrated means it would have been migrated to the omentum, adhere to the adnexa, and sometimes bowel perforation can also be noted in these devices. Okay, and finally, the most common complaint the patient presents to you is missing thread. Okay, so what are the possible causes of this missing thread? Okay, number one, there can be torn end of the thread. Okay, or there can be expulsion of the device, or there can be twisting of the thread, or there can be a perforation which we are discussing now, or there can be a chance of pregnancy as well. Okay, there can be a chance of pregnancy as well. Clear? What do you have to do when a woman presents with missing thread means you have to take X-ray pelvis to detect whether it is in the cavity or it has been expelled. Okay, so that is the first step. Also, you can use ultrasonography to determine whether the device is present intrauterine or extrauterine. Then, if it is intrauterine, it can be easily removed by a hook, and this can be better done by a hysteroscopic removal. Okay, and suppose if it is present extrauterine means definitely the woman will need a laparoscopic removal, or sometimes this can be converted to laparotomy as well. Okay, Another scenario what we have to think is, already we have seen IUCDs have a risk of pregnancy failure. So, some women may get pregnant with the IUCDs inside too. Okay, so what will you do in that case? So, women who get pregnant with IUCD inside too. Okay, so usually these women present with the complaints of amenorrhea suddenly. Okay, then on examination, if you are examining this woman, the string may be visible up to 14 weeks, and thereafter this goes inside. Okay, so for this woman, it is a contraceptive failure that you have to understand. So for this woman, what you have to understand, what you have to do is you have to give counseling regarding whether she need to continue the pregnancy or terminate the pregnancy. Clear? Suppose if she plans to terminate, then MTP is done if she wants. Clear? Suppose if she wants to continue, she has to be counseled that there is a risk of infection, abortion, preterm birth as well. Okay? So, when she comes with pregnancy, you have to look for the thread. Okay? So, look for the thread. Then, if it is visible, just remove it. Okay, it is removed. There is a slight risk of abortion when you are removing. And suppose is continuation of the, suppose even if the woman is ready to continue the pregnancy with the inside to device, okay, because there is a risk of miscarriage here, she is not willing to remove it. Okay, she wants to continue the pregnancy. That time you have to advise her that even then if she wants to continue like that, the risk of birth defect or not increased. Okay, it is comparatively safe only. Clear? So, how you will follow up these women? You have to give them advice that there is a chance of pelvic cramp and pervaginal bleeding, which can be increased, okay, especially during her cycles. Then patient is usually asked to come for follow up after 3 to 6 weeks of insertion. Okay, then the woman should be made to feel the thread on table itself after insertion of the copper IUCD, and she should be checking it regularly during her next cycle and on and off from that time, okay, regularly, and especially if it stays for 1 year, then at least annual checking of the thread should be done. Clear? Right. And then finally, she should be advised how many years she will keep that device and when the changing of the device is needed. Okay, so this should be advised. Clear? Right. I want to introduce a term here, that is long acting reversible contraceptive, which is LAR. Okay, these are contraceptives which needs use of once in more than 1 month. Okay, so they are called as long acting reversible contraceptives. Among the contraceptives we have discussed, the contraception which is coming under this category include your injectable progestogens, then your subdermal implant, and finally your intrauterine contraceptive device. Clear? Now, what are the advantages of long-acting reversible contraceptive? Advantages is that it can be used safely for all ages. Okay, all ages. Then it is very safe irrespective of parity, breastfeeding, obesity or diabetes. And then already we have seen it is a reversible one, and then it does not need daily monitoring. Okay, does not need daily monitoring. Because of that, there is a high continuation rate, and finally there is no effect on coitus as well. Okay, so these are the advantages of long acting reversible contraceptives. So with this point, we'll be completing this video. So until we meet in the next video, keep going, happy learning, and take care.